Hello and welcome to this video. For those who don't know, my name's Kris. I'm an Australian GP, and today we're going to be talking about the importance of skin cancer and skin checks. It's no secret that Australia has one of the highest incidences of skin cancer in the world, given not only our geographical location and the ozone layer, but because the Anglo-Saxon population here, who came from the Northern Hemisphere and Europe, etc., really hasn't had time to adapt to the geographical location. When you think about the skin colour and the melanin and the protection that the Indigenous population have here, they are more adapted to the geographical location, the ozone layer, the UV exposure, and so on, whereas we're not. So we have quite a high incidence of skin cancers here in Australia. As a matter of fact, over 80% of new cancer diagnoses in Australia are skin cancer related. And melanoma, one of the types of skin cancer and arguably the most deadly and most concerning, is the third most prevalent skin cancer following only breast and prostate cancers. The term skin cancer does encompass quite a few different subtypes, so you can classify them as melanoma and non-melanoma skin cancers, and the non-melanoma skin cancers generally are broken down into two main groups, the squamous cell and the basal cell carcinomas, SCCs and BCCs. There are some nuances in different types of them, but really it's the three main big ones: melanoma, SCC, BCC. All of them are significant and all of them do require treatments. However, as I've kind of alluded to, melanoma, it's the biggie. It's the one that we're really cognizant of. It is recommended that Australian adults have an annual skin check. So what does that actually entail? Well, that's what this video is about. What makes for a good skin check? Now, of course, everyone's going to do it slightly differently, and the way that I perform a skin check may not be the same as the way that your doctor performs a skin check. However, when it boils down to it, the main bases are: 1, taking a good history. How much sun exposure do you get? Where are you getting sun exposure? At what times? How many sunburns have you had? Is there a family history of skin cancers? Knowing all of this when we go into the skin check, before we even check your skin, is vitally important because it changes the risk and it changes our level of comfort, I suppose, for certain lesions. So if you were 21, never had a sunburn somehow, didn't get out in the sun very much, and you had no family history of melanoma or other skin cancers, then a mildly abnormal looking but pretty benign looking mole that I look at will probably not prompt me to biopsy it, but just to monitor it, versus if you were even the same age, 21, got a lot of sun exposure, had multiple sunburns in your lifetime, out in the sun every day, and one of your parents or siblings or someone had a melanoma, suddenly that same maybe benign looking mole needs to have a different review process. So whether that be a biopsy or another review in a shorter time span, 6 weeks, 3 months, because your risk is slightly higher. So a really good history is really important. Secondly, to do a skin check, the lighting is really important. Natural lighting is actually the preferred lighting method. However, that's not always possible. 1, for privacy reasons, and 2, because not all doctors' surgeries, let alone doctors' rooms, have the ability to have a window in their room. So natural lighting is preferred. However, as long as your room is well lit, you can have a good skin check. Number 3 is having good equipment. So the equipment we use typically, unless you're in a very specialized area of skin cancer medicine, is a dermatoscope, which is a handheld derm, meaning skin, otoscope, like a microscope. So it sort of enlarges things. These have really good lights on them that are polarizing and non-polarizing and allow us to see the lesion in different levels and also be able to magnetize them, measure them, and look at them really closely. There are hundreds, if not thousands, of different dermatoscopes on the market. And if you're in a more specialized skin cancer clinic, you may even have like a mole mapping machine or something like that, which is basically a really good dermatoscope. Regardless if you spend a couple of hundred or a couple of thousand on your dermatoscope, as long as it is a good quality one and you know how to use it, that's what's important. So I use a digital one by Vios. It's an iPod Touch within the actual dermatoscope, which allows me to keep photos of the patient's lesions and upload them to their chart, which I find really useful for not only, repeat checks, but also my learning. So if I take something out, I can then go back and denote it as like, this was not melanoma, this was this. And so if I see something similar, I can sort of get that gist. So that's something I prefer. A lot of people don't like having photo technology or don't use it, or find that the quality of the image is less than some of the more traditional dermatoscopes, and that's fine. I know how to use mine and I like it, and so I'll use it. So it really has to be good quality equipment that you know how to use. Number 4 is a good exposure. So there is no point having a skin check fully clothed. So yes, there are areas of the body that are more exposed to sun in day-to-day living: the face, the chest, the hands, the arms, the shoulders, and the legs. However, skin cancers and melanomas in particular can crop up anywhere. I've seen them on buttocks, I've seen them on the bottom of feet, I've seen them between toes, behind ears. So it's really important that the doctor discusses what the exposure is going to be for the patient and that the patient is comfortable with that. If you're not, that's okay. You do not have to expose anything you don't want to. However, knowing the importance and having that discussion is probably what I'd recommend. In my personal skin checks that I do as a GP, I don't get people to take off their underwear. I do ask, however, if there is anything under there that they are concerned about or that someone else has noticed. And this just leads to discussion about checking. And if they say, nope, all good, that's fine. If they say, actually there is, then I look. It's more a comfort thing, because there is nothing worse than being completely exposed, completely naked, and having someone look over you with a light and a microscope. Like it can be very confronting, I suppose. So patient comfort's obviously paramount. And number 5 is it's all in good timing. You should never feel rushed through a skin check. It should be thorough, and if it has to take time, it has to take time. Doing a skin check on someone who is younger with very minimal skin exposure may only take a couple of minutes, but doing a skin check on someone older with more exposure and more lesions may take up to 20-30 minutes. The whole point is to try and find skin cancer, detect it early, and treat it early. So you'd want this to be done in as much time as it needs to be done in, right? The final little thing I'll add is when doing a skin check, it's always recommended that it's done the same way for every patient, but the way that I do it and the way that someone else does it may be different. So personally, I get people to sit down, I check the top of their head, go through parts of the hair, go back down, do the neck, the ears, come across, do the face, the neck, the chest. Then I get them to take off anything that they've got on the top, and I go up and down the arm, and I get their arm up, and I'm going down here, up and down the arm, same thing. Then I get them to stand up, and I look at their whole back. Then I come around, and I check the whole chest. At this point, they can put back on their top shirt, whatever they had on. I get them to take off their pants, and I get them to lie down. And then I go down one leg, check in between toes, check ankles, go up the other leg, have them roll over, so now they're on their stomach. Go down one leg, check under the foot, around the heel, go up the other leg, and we're done. For me, it's very methodical. For me, I know if I get interrupted where I was up to, what I have and haven't checked, and I know that it's the same for every patient, so I'm not going to miss anything. After a skin check, I make sure that we document everything concisely. So if I found lesions, I'll mark them. If I've taken photos, I'll label them and upload them within the consult, usually. It depends how long it's taken. And then if there is anything that I'm really, really worried about, I'll do my best to biopsy it then and there. However, I'll often get people back. If there is anything I want to check up on, I'll put reminders in, or I'll see people in a year. But I will always communicate this and say, look, things look great, or I want to check on that one, or come back next week, or whatever. Again, communication is just key. So if you've learned anything from this video, it's that you should probably have a skin check sometime soon. It is something that even if you don't think you've got any lesions on you, is really important, because early detection prevents a lot of heartache. That's it from me today. I hope you've learned something about skin cancers, how we detect them, what to expect at a skin check, and I hope that this does prompt you to go and get yourselves and your loved ones checked. If you have any concerns, obviously bring it up with your doctor. But if you have any questions or queries for me, please leave them in the comments below. Like, subscribe, and I will see you in a video very soon. Until then, take care, guys.